So one of the commonest questions I get asked when patients are put on blood pressure pills, they always ask me, once I start this, does it mean that I need to take these pills for life, doc? Well, the answer to that is not necessarily. High blood pressure can sometimes be caused or accentuated by stress, anxiety, by external factors. And sometimes if we change our lifestyle, as I said before, if you reduce your weight, you change your lifestyle, you have a healthier diet, you have proper rest and sleep, your blood pressure can come down naturally by 5 to 10%. So if your blood pressure comes down, it is possible to come off these tablets. However, there's a good number of patients where the blood pressure may be persistently high, and in this group of patients, it may not be possible to reduce entirely all the blood pressure medications. You might reduce a little, but not all. But for some patients where the blood pressure is mild or moderate, with the adequate lifestyle changes, you might be able to come off the blood pressure medications eventually. So I have hypertension. I need to see a doctor. What test should I do, doctor? That's one of the common questions that I get asked. So when you see a cardiologist, these are some of the possible tests that the doctor may want to carry out. He would want to find out whether you have primary hypertension or secondary hypertension. Hence, he would want to do a series of tests to exclude a secondary cause for your high blood pressure. These may include a series of blood tests and urine tests to exclude kidney disease or hormone imbalance. He may also wish to carry out an ultrasound of the kidneys to look for conditions such as renal artery stenosis, which is a rare but not uncommon cause of secondary hypertension. In addition to looking for a cause of secondary hypertension, your doctor may also wish to look for evidence of end organ damage, means damage caused by the high blood pressure. So he may do an ECG or echocardiogram to assess the heart function, whether there's enlargement of the heart muscles. May also wish to assess the eyes to look for any retinopathy, which is damage to the retinas by the high blood pressure, and also assess the kidney function again for any kidney damage. So these are some of the tests that your doctors may do. And depending on the results of this test, then your doctor would be able to advise you on what the cause of the hypertension is, and therefore decide on what the best form of treatments are available, and would be able to treat you appropriately. Another common question I often get asked when I start somebody on high blood pressure medication is, will the medication be too strong for them? Many patients are worried whether their blood pressure will come down too low. How low is low? Well, based on the guidelines, blood pressure medications are often given when the blood pressure readings are above 140 over 90 millimeters of mercury. And the aim is to get them down to an optimal blood pressure, which is often below 120 over 80 millimeters of mercury. There are many patients whose blood pressure are much lower than that, and they are fine with a blood pressure of 100 systolic or 110 systolic over 50 or 60 millimeters of mercury diastolic. Blood pressure is too low when patients become symptomatic. That's when blood doesn't get to the brain and causing giddiness, or it doesn't supply enough blood to the vital organs, such as the kidney, causing end organ damage. So, in effect, there is a J-curve to the cardiovascular benefits of blood pressure lowering in hypertension. The greater you lower the blood pressure, the greater is your cardiovascular benefit. However, there is a threshold below which when the blood pressure lowering is too much, when the side effects of blood pressure lowering starts to outweigh the potential benefits of protecting the heart. For most people, this would mean a systolic blood pressure of below 100 millimeters of mercury, or diastolic blood pressure of 50 millimeters of mercury or below. This is an important point, particularly in the elderly patients, where we do not want to lower the blood pressure too aggressively, as this may be potentially dangerous, leading to falls and fractures. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.